Did it. Okay. Welcome, everyone. This is our second Making an Impact meeting. These meetings were started to kind of give everyone an overview of our program impact reports, which can be found on the H drive. When I share my screen, I'll show everyone how to get there if you want to look through any of the other programs. Last month, we talked about emergency preparedness, and this month we're talking about epidemiology. Which we have our very own epidemiologist here, Aurelia. And we have some other folks who work in our epidemiology realm, so we'll be going over that too. If anyone has any questions, feel free to put them in the chat or save them for the end. We'll have some time to talk, and if you have questions for Aurelia, she's the expert. I know probably a very small fraction of the world of epidemiology. This is really an overview to what we do here at the health department. Okay, I will, oops. Okay. Perfect. All right, does anyone have any questions before we get started? Any logistical questions or about other meetings? No, okay. Okay, can everyone see the whole slide? Okay, cool. Making impact, epidemiology and surveillance. Okay, so what is epidemiology? Epidemiology is the method used to find the causes of health outcomes and diseases in populations. So we're looking at this bigger picture of a community as sort of a patient. So I put here, doctors are to patients as epidemiologists are to the collective community. We're looking at the overall health and maybe trends or maybe clusters of diseases and trying to figure out why. Hold on, some people in the waiting room. Okay, so the definition, I kind of broke it down here, the fancy jargony definition into its parts. So it's the study of the distribution and determinants of health-related states and events in specific populations. So the study being scientific, systematic, data-driven, which is a huge part of epidemiology. It's based on data and what we can observe. We have distribution, which is the frequency and pattern. Like I said, looking for trends and things that are appearing. Determinants, causes, and risk factors. And we have health-related states and events, which may be diseases like communicable diseases, but we could also be looking at rates of arthritis or different health behaviors. It's not always about just observing disease. And then we also have our specified populations, which could be as small as a neighborhood, a school, a city, state, country, globally. There's all different kinds of populations. It doesn't just have to be, for us, we work in Barry-Eaton counties. So a lot of times our population includes those two counties, but it may be bigger, maybe looking at a specific zip code. But that is what we mean by our specified populations. So on the next slide. There we go. We're going to do a word cloud activity. So if you have a phone or you can open up another tab on your browser, we'll share that screen. Okay. Taking its time. Okay, so you're going to go to www.menti.com, and the code that you'll put in is up here at the top, 352463. I'll give you guys a minute to pull up the website, and we'll be using it one other time, so feel free to leave the website open on your phone or your laptop, and then we'll come back to it too. Is there anyone having issues with getting into this website? No? Okay. So once you're in, we can kind of start. The question that I've put on here is, what populations might we gather data about at Barry-Eaton? So feel free, I think it lets you enter up to 8 answers, but just submit your answer and it'll start appearing on the screen. And we can kind of see what people are thinking about, what populations maybe you work with at Barry-Eaton, and get us kind of thinking about what types of information we might want to know about in our community. All right, so we're getting immunocompromised, the elderly, teachers, students, and we have our HRAs here representing students and children, mothers. We do a lot of work. WIC does a lot of work with mothers. We have low income, maybe people on Medicaid, underserved. You guys are doing a great job. I love this. So you can see there's a lot of different populations that we serve, and there's a lot of different types of information we can get about these different groups. A lot of them have different, like the risk factors, determinants. They may have different geological or geographical distributions in our communities too. But you guys are doing great. So let's go back to the presentation. Okay. All right, so who are epidemiologists? Here at Barry-Eaton, we have Aurelia, our epidemiologist. We have Chris Chesley-Hughes, our data analyst in personal health, formerly in PPE with us, but we forgive him. And then we have Sydney Kincaid. She is our newest community health promotion specialist, working a lot with Aurelia on our community health assessments and health improvement process, which is a very data heavy project that really takes a lot of those epidemiological practices. And we have KT, our disease intervention specialist, formerly disease investigator, who does more of that one-on-one, trying to figure out maybe where outbreaks are coming from and where someone may have gotten a certain disease, so we can try to work on improving it. So one of the phrases I heard about epidemiologists is that they are disease detectives. So they're looking for patterns in disease and health status in the community, looking for causes of disease, which might include how are people getting sick and who are the people getting sick? Where are they getting sick? When are they getting sick? And trying to put together this picture of why are certain groups being more affected than other groups, and how can we, work to improve that? They identify people who are at risk, determine how to control or stop the spread or prevent it from happening again, and identifying new diseases. We saw this with COVID. Epidemiologists really do a lot of work to investigate, okay, who's getting sick from COVID? Where is it coming from? Who's at the highest risk, and how can we prevent disease and suffering really in the future? Let's go to the next slide. Okay, so in the program impact report, it mentions epidemiology and surveillance. So the surveillance part of it is not an FBI van outside in the parking lot, but that'd be kind of cool. It's, a little less exciting than that. So we have public health surveillance is the ongoing systematic collection, analysis, interpretation, and dissemination of health data to help guide public health decision-making and action. So the collection part of it being gathering the data, doing surveys, things like that. Analysis being taking that raw data and really looking at, okay, what does this data actually mean? And what are we seeing in the patterns and rates and mortality and morbidity? The interpretation of it, how do we translate that data analysis into something that the community can use, either in their programming, in our programming, or even policy for the county, the state, country. And then dissemination. So we primarily do this through our health data reports, which are available on our website. And we also do our community health assessments in each county, and we do a community health improvement plan based on that assessment. A lot of times it's called information for action. So we're gathering all this information for a purpose, and the purpose is to do something about it. If we're seeing a huge cluster of lung cancer because they live close to a factory, that doesn't really mean anything if we're not going to do something with that information. You might create a program and get those people inhalers or some sort of filter for their homes, and then that's the public health work that we're involved in, is really trying to help that and see what's going on. I have this nice little chart here that shows kind of this epidemiological cycle of, we have public and healthcare providers clinicians, labs, hospitals who really collect a lot of that data. Surveillance really relies on data reports and the availability of data. We have a lot of access to data at the health department just through, I put MDSS here, which is the Michigan Disease Surveillance System. I know all of you in personal health that know way more about this than I do, but we do our surveys for our health assessments. There's state level surveys, there's national level surveys. There's death data about mortality, excuse me, about mortality and morbidity. You know, really like what are people dying from? And is it something that we can prevent or, you know, do something to help it? And so we have our public and healthcare providers, and then we're moving on to, oops, sorry, the wrong button. Then we're going to reporting. So this is that putting in that information and then a place for us to look at it, an electronic system, which the health department wasn't always like that. We were founded in the 30s, and a lot of it was way harder to get access to because there wasn't a centralized way to share data. Where now we are really privileged to be able to just send a large Excel spreadsheet to someone else or be able to have a database connected to the internet is a huge advantage for public health. And we take those reports to the health department, that's us, and then we analyze the data, see what's going on, and kind of give feedback back to the community. So it might be advice for health providers, like we're seeing this trend, like look out for this, or there's a chickenpox outbreak, and here's how you can, this is what you should tell your patients, or here's how we can prevent more cases. So it's this continuing cycle of getting data, analyzing it, like collection, analysis, interpretation, and then dissemination. And historically, a lot of this data focused on communicable disease, whether it's flu, chickenpox, some of those more classic diseases, but in more recent years, it's really started to include things like injuries, genetic birth defects, occupational, environmentally related diseases, and health behaviors. But we will keep on chugging. Okay. So now that we've kind of talked about what is epidemiology, what is surveillance, how do those interact, and how they really influence public health decision-making and a lot of the policy that we do. So how do we use epidemiology and surveillance here at the health department? Our activities include analyzing, reviewing county data, state data, and national data to assess the health of our community and our district that we work in. Identifying trends in communicable and chronic diseases, accidents, morbidity, mortality. They help guide activities at the health department, identifying areas for public health intervention, and really trying to focus our efforts, like where is the help needed? What is actually a problem in our community? What can we actually do to help that? All of us know in the last couple of years, we've really dealt with COVID. We've really dealt with monkeypox, now mpox. We do tobacco work. We do maternal child health work. And this is all influenced by epidemiology. These are health problems that have been identified through data and collection and analysis and things that we have the opportunity to make better and, you know, do our part. We also use this information to report to our stakeholders and funders to inform our CHA and CHIP process, which is what I mentioned before about each county has their own process. Eaton is part of a collective group called Healthy Capital Counties. And this group is including Ingham's County Health Department and then Mid-Michigan Health Department for Clinton County. So these three counties work together to share data, knowledge, resources to try to capture the kind of the picture of health in the capital area counties. For Barry County, we do our own with Spectrum Health, now Coral Health, kind of looking at the health of Barry County as its own county. And really there's a quantitative part of this process where we're pulling data from all these different sources. That's where Aurelia and Chris and Sydney come in, and they're doing analysis of this data and really trying to interpret it for people like me, people in the community who I can go on, you know, on the state's website and see how many lung cancer deaths there were, but I don't know what to do with that information. So we try to prioritize it, try to give the community a picture of what's really happening and what can we do. That's the health improvement plan. is a group coming together and saying, okay, we have this data, we've analyzed it, we've disseminated it. Okay, now like what's the action? What are we going to do to actually address these issues? And you can find, we have both of our community health assessments from the last year or so on our website, and they each have their own individual websites as well, but you can see some of the data analysis is in those reports. There's narrative parts of it if you want to read through about, there's experiences from focus groups, there's content about like just analyzing the data, like what does it mean? And they're great reports. We put so much time and effort into them, and they're super valuable, not just for us, but other community organizations that are working adjacent to public health and might need that information for grant funding or just program policy or program development. We also have a few other reports on our website that Aurelia has made about, we have an influenza surveillance report that she does. We do COVID data reports every week. There's all kinds of data that has been collected from these different systems and then put out back into the community. And sometimes they sit there and maybe only a few people read it. Sometimes a lot of people read it. It's just, we want to make sure we're making it available, being transparent, and providing really a service for the community to be able to utilize our analysis so that not everyone is doing their own little individual analysis and kind of reinventing the wheel. We work collectively to, make our communities better and healthier and safer. But we will go on to the next slide here. Okay, so we're going to do the activity again. So you're going to www.mentee.com. And I will go back to that screen. Okay, so which programs, maybe it's a program that you've worked on or a program we have at the health department, but which of them do you think are influenced by epidemiology? Oh, yeah, we've got communicable disease, children's special health care services, WIC, COVID, tobacco, oral health, IMS, our coalition work, our vaccines, our connections program. And really, the biggest one on here is all of them. All of our public health work has been influenced by epidemiology on some level. Some of it is more direct, some of it is more about policy and directing the work that we do. Let's go back. It's all of them. You guys did it, and I'm so proud of you. So we have Aurelia here, our epidemiologist. I saw you just turned your camera on. Or maybe you've been here and I didn't see it, but I have a few questions for you for the group if you'd like to chat a little bit about your position. But what is your favorite part about being an epidemiologist?
I guess it's the investigative work, stratifying that data, seeing if there's any trends, is a certain age group being affected? If we're seeing more diseases, it's like looking at their immunizations, those different investigative work that goes into that. Or if you're looking at trends across different years, did something happen in one year that, cases plummeted or cases went through the roof? And sometimes that's due to new recommendations. So for example, you'll see like Hep C cases go up, but there was like a new CDC recommendation for screening for that. So, looking at those different things and making sure that the public understands that.
Mm-hmm. Absolutely. Does anyone else have any questions? I want to make sure I'm not ignoring the chat. Allie, thank you for the compliment. Luca, yes, you have a question.
What does the public most often get wrong about epidemiology or epidemiologists?
Yeah, I definitely think the biggest thing is thinking that it's primarily communicable diseases that epidemiologists work on. I think that is one of the biggest things I see out there. And that's not true. Epis can work on a variety of different topics. It can be, Emily did perfect by explaining, the different roles that EPIs can do, but it's pretty much anything. So I've gotten an array of requests from, bedhead during my time here. It's like oral health, it's opioids, it's, other substances, it's community health. It's just, it ranges to everything.
Mm-hmm. Do you do a lot of work with epidemiologists at other counties?
Yeah, so you mentioned the Tri-County area. So we work with the epidemiologists over at Ingham County Health Department for our community health improvement plan and our needs assessment. And then, there's an EPI listserv. So sometimes they'll send out, we're doing our community health needs assessment and we want to take a look at our survey questions. So, there's different collaborations that occur from, across county lines here. Yeah, and it's good networking too. I'm a newer epidemiologist, so it's nice to have that network of people to, go to, because it's hard to get everything standardized and get those measurements standardized across different counties, because you want to be sure that when you compare data, it's the right measurements that you're taking and the same parameters.
Mm-hmm. Yeah, it's hard if you've asked someone, how many times have you smoked in the last month? And someone else's survey is, how many times have you smoked in the last 30 days? Like, not 30 days, that's a month. But like, how often do you smoke? And someone might put once a day, and then the data doesn't line up right because your questions are different. So I know we did a lot of survey work with the health assessment.
Yes.
All right, is there anyone else who has any questions for Aurelia or Sydney or Chris, any of the team? I know KT couldn't be here, but. And also this, I will be sending out this presentation. So if there is something you wanted to look at again, it does have the links to our health data reports. You can also look around on the website. We put them on there, and there's also a health data request. Something else that we do is if maybe a community partner or an individual is working on a certain health problem or certain population, and they want to know if we have that data or if there's something that we can provide to help them kind of guide that work. And so there's a form that they can submit a health data request, and Aurelia will work with them to get them the data that they need, which is probably a resource maybe not a lot of people know about or know that they could utilize it, because we're here to help the community. So if we're able to give someone something they need, we're going to do it. All right. I am going to stop the recording now. If I can figure it out. I gotta stop screen sharing. I know how to Zoom.